The human brain is a wonder. Very few things are off limits for the brain. And now, in an attempt to boost patients' mood, a trial conducted by the National Health Services, or the NHS, plans to use a brain-computer interface, something that directly alters brain activity using ultrasound. Revolutionary, isn't it? But how does it work? The device, designed to be implanted beneath the skull but outside the brain, maps the activity and delivers targeted pulses of ultrasound to switch on clusters of neurons. As per reports, the safety and tolerability of the device, it needs to be tested. In a trial funded by the UK's Advanced Research and Invention Agency, about 30 patients are slated to participate in this trial. Starting from March this year, the study will run for 3.5 years, reportedly with the first 8 months focused on securing regulatory approval, which, if achieved, may graduate into a full-blown clinical trial over time for diagnosis of select conditions. But what does it seek to achieve exactly? Doctors hope that this technology could revolutionize the treatment of depression, addiction, obsessive compulsive disorders, or epilepsy. How is that? By balancing disrupted patterns of brain activity. More or less, all the diseases mentioned above are connected to the brain function in an integral way. And experts suggest technology such as this one, if proven successful, can only facilitate better outcomes and also help treat a broad range of issues. This also means a huge opportunity where scientists and researchers feel boosted to tap into the potential of newer types of technologies that might have answers to complex issues. Elon Musk's brain-computer interface, or BCI company, which is Neuralink, launched a clinical trial in patients suffering from paralysis. In fact, during a recent interview at a Las Vegas event that streamed on X, Musk announced that now a third person has received an implant from Neuralink, which marked another milestone in the company's efforts to connect the nervous system to machines. Not just that. Another study worked on restoring communication to patients who had suffered strokes by translating their thoughts directly into speech. And now this trial seeks to take the BCI technology one step further. But just like any other medical venture, of course, it's not without its share of challenges. You see, technologies such as this one raise significant ethical issues about the ownership and privacy of data, the possibility of enhancement, as well as the risk of neurodiscrimination. That's because data acquired from the brain might be used to judge a person's employability, his or her eligibility for medical insurance for that matter. At the very outset, innovations such as these look promising and instill a great deal of hope. As far as medical breakthroughs are concerned, there are other sensitive issues that need to be addressed. For latest news, download the WION app and subscribe to our YouTube channel.